Okay. Thank you everyone so much. I am going to close our poll. We appreciate your responses. And I would like to now turn it over to our wonderful guest, Abel, our resident movement coach and trainer. Abel, go ahead and take it away for our weekly warm-up.
All right, guys. Thank you so much for having me first, and thank you guys for joining us. My goal today for you guys is just to move a little bit, whether you're in a seated position, you're comfortable, or you want to do some standing movements with me. I just want to get a chance to loosen you guys up. So I'm going to share some music first, right? Even if it's a few minutes, it can go a long way. So I'm going to play some music. All right, you guys. So again, guys, my goal is to move with you guys and exercise. Make sure you do some of these movements at your pace, right? If it doesn't feel comfortable, definitely don't do it. So we're going to start off with the lower body, guys. Let's just kind of march in place. Whether we're seated or standing, we're just going to march in place. And then one leg at a time, what we're going to do is we're going to kick one leg out forward, push our hips down, and then just reach, right? So jogging in place, one leg forward with the toes up and reach. So I'm gonna give you guys the side angle so you can see. So we're just gonna jog in place, one leg forward, push the hips down, reach, hold for a second, okay? So if I was to do it from a seated position, again, jogging in place, one leg forward, and I'm bending, right? And the goal for this is to stretch out the hamstrings, the back of the legs, right? Other leg, and reach. All right, one leg at a time, reach, and reach. All right, so we'll do it for 10 more seconds. We'll go for 10, 9, 7, 6, 5, 2, and time. All right, guys. Okay, so we're gonna climb up. So we're gonna go hamstrings, and now we're gonna try to get the groin area. So I want you guys to have your legs spread out just like this as much as you can, and make sure you don't have anything around you, okay? Now we're gonna go hands up right here, and we're gonna practice just kind of reaching to the opposite foot, just like that, or the opposite knee, right? Hands up, pushing the hips back and reaching down, okay? And like you guessed it, could be done seated, same thing, just reaching down and bending. Loosen up your body, especially if you've been sitting down most of the day. You have to do some of these movements to loosen up before you go to bed. Okay, so we'll go for 10 more seconds. 10, 9, 8, 7, 6, 5, 4, 3. All right, guys, good job. All right, guys, so we're gonna climb up. Now our goal is to stretch the glutes. So again, standing or seated in a long period of time, that's gonna irritate some of these muscles. So I'm gonna give you guys two options. First option is in a seated position. We can bring one knee up and hold it, or maybe even hug a little bit towards your chest. That's the first option. And this is a holding exercise. If you are comfortable with it and you have no pain doing this, you can also bring one knee up, rest your ankle on the leg, right? And we're just gonna kind of bend forward and just hang out like this, okay? So this is definitely a movement you can do every single day. Highly recommended, especially if you're, working long periods of time on the computer. So for now, we'll just hold it for 10 more seconds. So we'll go for 10, 9, 8, 7, 6, 5, 4, 3, 2. All right, guys, let's bring it down. Okay, loosen up a little bit. Okay, now we're gonna go with the opposite leg. Okay, so again, the first option that's less intense will be to just bring one knee up, maybe even hold it, or maybe you can just hug it just like this, or you can bend it over, which is a little bit more tougher to stretch the outside hip. So we'll do 10 more seconds of holding. Okay, so we'll go for 10, 9, 8, 7, 6, 5, 4. All right, guys, good job. Okay, so we're gonna climb up and now work on the lower back and also our upper back, okay? So if you're gonna do this standing with me, you have your legs opened out again. And what we're gonna do is just a simple twist, just to move around the spine. So we're just gonna twist from side to side. And I kind of like to pivot, right? Just swinging my arms up high, loosen up the shoulders too, turning side to side. Okay, so I'm gonna do this one standing, but if you guys choose to do it seated, right? Same thing, you can twist and maybe even, pull back, get a little bit more rotation at the end of the twist, right? Or you can do it standing if you choose to do so. So we'll go for 10 more seconds. 10, 9, 8, 7, 6, 5, 4. All right, you guys. So we're gonna climb up. Now we're gonna do a little bit of side bending. So we're gonna still keep our legs out wide. So what we're gonna do is we're gonna side bend, go to the side, right? Maybe do like another half rep. Come up, do a rep, and then another one, right? I know this feels good. Some of you guys are like, ooh. So side bend one side, and then the other. So we'll go for 10 more seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, and that's time. Good job, you guys. All right, now we're gonna go to the shoulders. We're gonna practice kind of shrugging and bringing our shoulders back just to loosen up. So I'm also gonna add one more movement. So if you just wanna do the shrugging, we're just shrugging and then bringing our shoulders back, squeezing our shoulder blades as well. So up and back, slowly, all right? If you wanna involve your legs, right, you can practice going on your toes every single time you shrug. So another angle right here, guys, up, shrugging back, just like that. Okay? So we're just gonna shrug for 10 more seconds. We'll go for 10, 9, 8, 7, 6, 5, 4, 3, 2, and time. Good job, you guys. Okay, now I'm gonna show you guys a very specific warm-up for your shoulders, upper shoulders, right? So I want you guys to have your hands turned out like this, right? With your thumbs pointing out. And you're gonna drop your shoulders down. You're gonna drop it down. Just your shoulders. We don't wanna bend like this. We're gonna bend it down, right? And then we're gonna bring our chin and our face down, just like this. And make sure you keep your hand pointing out. We're just gonna hold it for 10 seconds, just like this. 10, 9, 8, 7, 6, 5, 4, 3, 2. Good job, you guys. Let's do the other side. So this, as you guessed it, is for your upper shoulders. Let's go other hand. So thumbs, hand pointing down, right? Shoulders down. And we're gonna bend our chin to the right armpit, right? If you don't feel it as much, you can bring it back or maybe bring it down, right? Play around with it. And we're just gonna hold it still. So we'll go for 10, 9, 8, 7, 6, 5, 4, 3, 2. All right, guys, I have one more for you guys. We're gonna do some slow head rolls now, okay? So do this at your pace. We're gonna slowly just go up and around, just like this, right? Just drawing a circle with your nose. Slowly. If you don't like doing this, just do some shrugs. So we'll just go for 10 more seconds, just like this. Slowly for another 10, 9, 8, 7, 6, 5, 4, 3, 2, and time. All right, guys, way to go. Thank you guys so much for moving with me. Again, my name is Abel from Revamp Fit. I'm glad to exercise with you guys, and I can't wait to join you guys next time for movements, all right? I'll give it back to you, Carmen.
Thank you so much, Abel. That was awesome. I feel great. I'm ready to go. So I would like to now introduce our wonderful guest this evening. We are very excited to welcome Dr. Bright, Dr. Crusto, and Dr. Doucet. So Dr. Bright, Dr. Cedric M. Bright is the Associate Dean for Admissions, a professor of internal medicine, and the Interim Associate Dean of Diversity and Inclusion at Brody School of Medicine in Greenville, North Carolina. He served as president of the National Medical Association from 2011 to 2012, advocating in the White House for health equity, increased diversity in clinical trials, and increasing the pipeline of students of color into health careers. He served on the roundtable of Black men and women in STEM for the National Academy of Science, Engineering, and Math, and has presented numerous grand rounds on the impact of COVID-19 on the Black community. So thank you so much for being here with us tonight, Dr. Bright. Dr. Crusto has her PhD. She is an associate professor of psychiatry at Yale University School of Medicine and is the director of program evaluation and child trauma research. Dr. Crusto has more than 20 years of experience in developing, implementing, and evaluating preventative interventions in schools and community agencies. She has extensive experience providing training and technical assistance to schools and community-based organizations on the evaluation of prevention programs. She's interested in culturally relevant interventions for children from racial and ethnic minorities and low-income backgrounds, and in-school-based behavioral health services. Dr. Crusto's research examines the impact of family violence on children and the ecological influences on child and family well-being, and her work includes rigorous evaluations of community-based initiatives. So welcome, Dr. Crusto. And last but most certainly not least, we have with us Dr. Doucet. Roberta Doucet has been practicing medicine for over 30 years. In addition to working as an anesthesiologist, she serves as Director of Women in Medicine at KP West LA, is a faculty member at Bernard Tyson Kaiser Permanent School of Medicine, and executive board member for the Association of Black Women Physicians, and a delegate for the House of Representatives. As a frontline worker in Los Angeles and a veteran anesthesiologist, Dr. Doucet has been working in the trenches with COVID-19 cases since the beginning of the pandemic, and caring for and witnessing the spread of the for individuals and witnessing the spread of the virus and how the healthcare inequities have affected the community she serves. Her priority has been to serve and educate those individuals. So thank you so much for being here with us tonight, Dr. Doucet. So to start us off, we have wonderful guests and lots of questions for all of them. A reminder to everyone, as we're going through the evening, feel free to put your questions in the chat and we'll do our best to make sure that they're addressed. So to start us off, the main topic of this town hall is the impact of stress on family members and how to cope with COVID-19. There's a lot going on right now. There's a lot of uncertainty. There really has been since last March, as March begins again. So I would like to start off by asking Dr. Crusto a couple of questions regarding the impact of stress on family members. So we know from medical research that when stress builds up, it creates what's known as toxic stress, which can have impacts on your physical health, not just your mental health. So could you talk to us a little bit about what does that mean? How might you see that manifest in your life for either yourself or some of your loved ones?
Great. Hi, everyone. Thanks for having me this evening. Just a quick note, I am a parent of a 4-year-old who you might see running in and out of here. And so I talk about this from a personal as well as professional standpoint. So toxic stress, yes, it is stress, and I'll talk mainly about children, but it applies to adults as well. It's basically stress without mitigation, right? And so you experience stress. So in children, it might be things like COVID, it might be things like child abuse and neglect. It might be things like racism in adults, but just this prolonged stress without, in the case of children, without having a supportive or caring adult that might act as a buffer against the stress. So your stress response system is activated and you don't really calm down. And so you just have this elevated or state of heightened alert, even when there's not really a threat. And so it's kind of like the revving up of your engine that just keeps going and there's no rest. And so over time, the state of high alert really overwhelms, and I'll talk again about children, the developing systems, and can interfere with growth and development. So it can impact brain architecture, or what we call structures of the brain that are involved in learning, emotions, relationships, attentional processes. And so it can have effects across a number of areas in terms of child development. And so again, this can apply to children as well as adults. And the ways that it might manifest, absolutely, it might be physical health, it might be mental health, it might be social relationships, it might be emotion regulation. So there are a number of ways that this might impact education, for instance. And the kinds of things that you can look for really changes in behavior. So change in appetite, change in sleeping patterns, change in relationships. And those are some of and so the also I want to stress that you can have stress and its impacts, and it doesn't have to be what we call at a clinical level. So interfering with your daily functioning, where you might need to see a professional or take medication or have talk therapy. Not all stress necessarily results in what we might call, for instance, clinical depression, but you might still have distress, what we call subclinical, but still can be problematic for you. And in those cases, you can still, there's still a lot that you can do. You can still reach out to professionals, but it doesn't necessarily always have to be in a clinical range to be of a, of a concern. So.
That is a wonderful point. Thank you so much for bringing that up. It is really important to reach out to other people and for other resources. So on that note, if you talked about some of the things that you might notice in a child or in another family member, so these changes in behavior and things like that. So how would you recommend talking to kids or maybe other family members or approaching that conversation, of how someone might be feeling, how they might be, managing their stress and maybe, how to reach out to them to help them because sometimes our greatest support systems are our families and, in this time it can be very difficult because, we are physically separated from a lot of people and a lot of our support structures. So I think now more than ever, it's integral to, really be there for one another in those ways. So how might you recommend kind of approaching that conversation? Because I think for a lot of people, it can be a little bit intimidating.
Yeah, so I'll start with children, given that's more of my specialty. But I think with children, you can remain calm, ask how they're doing, if they have fears. But you can also sort of watch out for their behavior. So in children, this might manifest in their play, kind of themes that you might see in whatever play that they're engaged in, and so you can sort of pick up on things there. I've used books. I have some here, Lucy's Mask, What is Social Distancing? There are many resources that are online from the CDC and the WHO as a way, again, to read with children and to be able to really have a conversation in that way. I would just make yourself available. Inevitably, with children, this is going to come up in some form or fashion as questions about why they can't see their friends or why they can't go certain places or do certain things. So inevitably it's going to come up. And so just making yourself available to be able to talk to them and listen, see how they might explain what's going on, what are some misconceptions or information that you can correct. And so really being available when it does emerge. I would limit what you show and what you see on TV. So we have watched a lot of things other than the news, which we don't watch in my household very much. And so you can limit information. I think that's really helpful in terms of things that are just developmentally not where they are, what they can understand or comprehend. As far as adults, I think the same thing goes in terms of being available. You can ask directly, but also noticing when things emerge. I noticed that, there's a change in, your sleeping or your eating habits. And so just being kind of almost matter of fact and just checking in with people, I think is really important. So
Thank you so much. That is, I agree, extremely important to just be there and to check in with others, especially during this time. Um, and so there are some other ways, I know that you and I talked a little bit last week. There are some other ways that, we can change routine or schedules and things like that to help us reduce stress. And last week, or yes, our last town hall, we also discussed some different ways to help reduce stress and promote, better physical health to help us manage during COVID-19. So, do you have any recommendations around, structuring schedules, things like that, especially for children? Because, you know, before COVID, when they could go to school and be out on the playground, things like that, having these other social interactions, those were sort of built into their everyday. But now that that's changing, how can we sort of, I guess, intentionally try to bring that back into their lives to help with their growth and development?
yeah, I think this is partly dependent on whether or not they're in school or out of school. And I know there may be hybrid models. My daughter is actually in school. She was out of school for about March to August, September. And so I really tried to think about, and I actually went online for some resources. Even though I work with children and families, I had to go online also and just to think about what would a routine and structure look like. And so academic instruction for a 4-year-old, really, what is that? That's about 10 minutes at any given time. So I'm not going to expect her to sit and attend and learn letters and all of these things, for an extended period of time. So you really have to think about what is developmentally appropriate. And you can reach out to teachers, you can reach out to other professionals to help you really think about what that is. And so if you think about any given day, a wake up time, a time for maybe some academic, related work, time for play. That's the work of children, play. So if that's inside, if that's outside, so there needs to be that, that structure. We read a lot of books. I tried to think developmentally, she at the time she was 3. What is it that she should be doing, and what can I approximate at home? I'm not, an early childhood educator, but what can I approximate at home? She was very upset that she couldn't color in lines. She was very upset that she couldn't use scissors in the way that she wanted to cut straight lines. And so I bought a ton of coloring books, and we colored and we colored, and we bought scissors, and we learned how to cut, and we learned how to do all these kinds of things. So it doesn't, for children, it doesn't have to be this massive educational plan especially for young children. They're learning all the time in their environment. And I would say sleep time, wake up time, meals, anything that you can do to provide that structure and routine that you had pre-COVID is going to be really important. And I would say that that's across the board in terms of the developmental periods for children and adolescents.
Yeah, I was going to say, even as an adult, I know that keeping on a schedule and kind of trying to have some structure definitely has helped me over the course of the last few weeks, because a couple of our other doctors had, recommended uh, very similar things. Thank you so much for sharing those insights. I agree with you. I think it's really important to continue engaging, children and ourselves with learning and with our environments, because even though it is a very strange time, there is still a lot to learn, and a lot of, new things that we can continue to do. So thank you so much for those insights. And so one thing that we've talked about often, and I know that we touched on in our last town hall conversation, was about some sources of stress. And for a lot of people, especially right now, um, considering that a new vaccine has been approved this past weekend, the governor has changed vaccine rollout, the plan in Connecticut. So I know from speaking to my family members, to my community members, that there is a lot of stress around the vaccine access, and also still in a lot of ways COVID in general. So something that we wanted to emphasize here at URU is the idea that knowledge in so many ways is power. And so we wanted to take the opportunity, as we do every week, but also I think especially this week with a lot of changes, we wanted to take this opportunity to talk about the virus variants, review the information that's constantly changing. And Dr. Doucet has a lovely set of slides, I believe, correct? And so we'd love to, okay, there we go. Dr. Doucet, if you would like to lead us through and empower us with more knowledge to help us kind of cope with some of the craziness that's going on in this world right now.
Mute myself. Okay, let me go back. First, I want to say the information that Dr. Crusto gave us is very important for adults too, because in the beginning of the pandemic, I was watching too much news and I was getting depressed myself. So, a lot of stuff that she says applies to adults too. In the beginning of the pandemic, it was like I didn't want to get out of bed and shower, and I was just just depressed. I think it's a low-grade depression, but so that's highly important for all of us. Everything she said for children basically applies to adult. So we are in the coronavirus pandemic. So like we were talking about, for my people suffer for lack of knowledge. And because of that, we have suffered, not only the patients, the people, but the medical professionals. We didn't really know everything going on in the beginning. At the beginning of the pandemic, before we did the shutdown, I lost my first relative. We didn't know that we needed to shut down. We didn't know how bad it was. So he, unbeknownst to him, had gone to a party, 80th birthday party, and had become infected. Him and there was at least 3 other people that ended up on the ventilator. Unfortunately, he did pass. And there's other stories like that, like the Black National Brotherhood skis. They did it. They had a meeting and a ski summit back in February before, again, we shut down. And some of those people died from that. But that was a lack of knowledge. So again, this is what this is about. It's about knowledge, like she was saying, so that we don't have to suffer and we can make informed decisions. And so this informational webinar is to inform you, empower you, but we can't give individual medical advice, but please discuss any diagnosis or treatment with your doctor, okay? And let's talk about, let's get that knowledge. So basically, virus is different from bacteria because that's a common issue. People think it's the same thing, but it's not. The virus is a pathogen or disease-causing agent. It's not a living organism because it can't reproduce on its own. So the COVID-19 is caused by a SARS-CoV-2, a member of the coronavirus family. It's named after the crown of spikes along its surface. So you see all the red spikes there. That is the virus spikes. And we're going to be talking about that more later. It's covered in spikes. And that's responsible for the cell attachment and transmission. So it's a single-celled strand RNA virus, and the RNA is inside that capsule, but it can make copies, but it can't really do it unless it's inside your human cell. So it hijacks your protein function to make more virus, and that's important. We'll be talking more about that later. So they talk about variants. What are they talking about? The variants are mutations. And the mutations are involving the spike. They could involve the viral surface. So what's important about these variants is that they allow for more rapid transmission and infection, and some may affect the severity of illness. So there's 3 main variants in the US, and you keep hearing about these variants. There's the UK variant, which may become dominant strain in the US. Dr. Fauci talks about that. The South African variant, which has been present in the US since December 2020. Brazilian variant, it's been present in the US since January 2021. Now, recently, they've been talking about other local viruses in California and New York. In fact, Fauci this morning, I saw a news headline that he's worried about the New York variant. So these variants are sometimes easier to transmit. That's why they're concerned, and they can increase infection rates. So we don't want these variants to happen. And one of the things that we would like to do is stop the virus from moving forward, because the more people that the virus gets transmitted into, the increase the number of variants that can occur. So the sooner we can stop this virus from moving and transmitting to people, other people, then we can stop some of these variants. So that's the goal, is to stop this virus. So let's go over the virus symptoms, the coronavirus symptoms. And I'm going over this because initially in the pandemic, they thought that the symptoms, basically they talked about fever and cough, and they acted like fever was like the main thing. They would be taking your temperatures outside, but there's more to it than that. The symptoms appear 2 to 14 days after exposure, and usually somewhere between 2 and 5 days. So you can have any of these symptoms. You can have none of these symptoms. So there's asymptomatic people, which means you have no symptoms. And there's people that may think that they just have a runny nose or something, like my daughter. Different people get different symptoms. You do not have to have a fever. So there could be shortness of breath, there could be fatigue,
listen to this with me.
headache, congestion or runny nose. Can you please mute yourself? Thank you. Vomiting or diarrhea, that happened to one of my uncles. He didn't realize he had it. And then of course, severe pneumonia, which is COVID pneumonia, which can result in people being on the ventilator, which is part of what I do at the hospital, is intubating people and putting a breathing tube in them and putting them on a ventilator, which is a machine that breathes for you. And that's a pretty serious situation. In fact, we didn't really know back then when the pandemic started. So again, our lack of knowledge was not there, that it's better to wait to put people on the ventilator. It's better to put them on high flow oxygens. And then kidney failure, which unfortunately my husband has lost 5 relatives to COVID. And this last one had failure of her kidneys because COVID increases your clotting. So it clotted off her kidneys. So her kidneys were damaged. And the loss of smell and taste. Some people may not have anything except that. So they don't even know that they had the virus. They're just shocked that they had it, but that can be the only symptom. But what is concerning is you want to make sure that if you do get diagnosed with this, that you go in for immediate care if you have trouble breathing, persistent pain, chest pain, confusion, inability to stay awake, bluish lips, which means you're not getting enough oxygen. So all those things, you want to make sure that you're there. And the issue with the coronavirus, what's known about it? So the problem is that we don't know how you're going to react. There's a range of illness, all the way from somebody with no symptoms to somebody with severe illness to somebody with death. So that's the problem. You don't know how your body's going to react, because sometimes we do get people that are unexpectedly sick on a ventilator that end up dying, and it could be a young person too. It's usually people older than 65. They usually have comorbidities, diabetes, hypertension, lung problems, and obesity is associated too. Early on, when I was intubating in the pandemic, I noticed that I would end up going to the bedside. More of the people were actually obese. So that's the issue. That can be a talk by itself, actually. So one of the things you want to do if you do get diagnosed is talk to your doctor about early treatment, because it's important to get on it and know when you need to come to the doctor. Some doctors do different early treatment than other doctors, so you need to talk to them and be forceful about it, because you want to know what are they going to do and what should you be doing to increase your to your longevity. Some doctors may put you on Zithromax, may put you on steroids, they may give you aspirin for the clotting effects. You know, other ones do different things. They're talking about now earlier infusion of plasma antibodies earlier in the process to save lives. And, you know, there's the remdesivir. So things are constantly changing in medicine. Remember that it's not the same. Every day is different. So don't get scared with this slide. You don't need to analyze anything, okay? So
Dr. Doucet, before you move on, we have a great question in the chat related to what you were talking about before. So someone had asked, when you say obese, because you were mentioning how obesity can be, you know, was a big marker. So when you say obese, is there a BMI where risk increases? Could you elaborate on that a little bit? Because I think that is a legitimate concern.
yeah, when you're talking about BMI over 40, you know, there's different categories of obesity, and obesity is known as an inflammatory process, and it's also associated with hypertension and diabetes, sleep apnea. So it's associated with a lot of medical issues. So that's why obesity is important. It's associated with stuff. It's an inflammatory process. Actually, that's a whole lecture by itself. So that in fact, there was a lecture the other day about that. So that is a good question. Thank you for asking that. So this slide, you don't need to analyze it. The reason I put it up, I thought it was very interesting. There's been a lot of deaths, as you know, over 500,000. But in LA County, they took the time to look at the demographics. So as you can see there, the Latino population in LA are 3 times more likely to die from COVID as opposed to their white counterparts. And the Black population is almost 2 times more likely to die than their than the white counterparts. And then interestingly enough, they put in poverty. So your zip code does have something to do with it. In areas with high poverty, you're 3.5 times more likely to die than areas without poverty. So I thought that was amazing because that is showing one of the many disparities. COVID long haulers. Now, this is important because some people think, oh, I will just get the virus, and if I survive, I'll be okay. That's not necessarily true, because even if you survive the virus, the 30% of people have long-term symptoms, and about 10% can suffer lung damage, which obviously can worsen the quality of their lives. Now, the symptoms can affect any organ in the body, brains and nerve, which would be, I'm going to list these, but you don't have to remember anything. I just want the point to be that any of these things could follow you after COVID for any length of time. Brain fog, memory loss, headache, loss of smell, lack of energy, vertigo, encephalitis, seizures, heart and vessels, arrhythmias, palpitations, myocarditis, chest pain, heart injury, myocardial inflammation, irregular blood pressure, scarring in the lungs, lung abscesses, shortness of breath, dyspnea, GI problems, intestinal problems, that's what that means, muscles, aches, fatigue, psychiatric state, panic attacks. One of my friend's daughters, she was having panic attacks after she got COVID. It was really sad. And she just got depressed. So there is and also a PTSD can occur, hopelessness, sleep disturbances. So any of those things can happen. And so you say COVID long haulers, it doesn't matter the severity of your infection, hospitalization history, because they're finding even younger people are affected by this COVID long haul. And most of the COVID people that have had this, you know, some of them have suffered health disabilities, which affect their ability to work, and it strains their finances. Even elite athletes have been affected. NBA star Jason Tatum, he says, oh, I get tired after COVID in the fourth quarter of the basketball. My husband talked about some other athletes that were affected. So yeah, even they can be affected afterwards. So post-COVID problems have resulted in all these clinics popping up all over and addressing these needs. So these are some of the sources in JAMA and JAMA Network about the post-COVID So how do we prevent COVID-19? You probably know this, but what's important about wearing a mask is that it covers your mouth and nose. You see the picture I have up there of the young woman wearing the mask. Cover your mouth and nose because it can go in your nose, obviously, if you don't have your nose covered. We know about the keeping 6 feet apart, space between you and your family, your friends. And you want to avoid crowds and stay out of poorly ventilated areas. The other piece of it is hand washing. And over here, you can see I put 20 seconds. That's important. You need to hand wash for 20 seconds. Washing with soap and water is important. And if soap and water is not important, they want you to use an alkalized base hand sanitizer, at least 60%. You don't want to touch your eyes, nose, and mouth with your unwashed hands because you could be moving that virus around and getting yourself infected. You want to clean and disinfect frequently touched surfaces. And then, of course, get a COVID-19 vaccine. We're going to be talking more about the vaccine later. Dr. Bright has a great presentation because there's a lot to be known about that, and we have a new one out. Coping with the COVID pandemic. And this is important, physically distance, but don't socially isolate. You want to stronger together because as a collective group, we can get through this together. And that's what we're doing here. So you maintain your contacts through phone calls, Zoom, texts. The alternate to family gatherings. The alternate is doing Zoom fellowship, whether it's virtual game night, movie night, wine tasting, you can do that virtually. You can do all this stuff virtually. Virtual cooking class and ugly sweater, virtual Christmas. And the sad thing is I've heard stories of families, and one family, they were so sad because they got together on Christmas, a group of them. And unfortunately, everybody in the family got COVID. And two of the people ended up on ventilators. So that is, a deadly Christmas for them. That's going to be a bad memory. You don't want those bad memories because this is going to be over and we will get together soon. This is a hopeful lecture. I have high hopes that this pandemic will end and we will conquer this. You want to exercise for health and mental well-being. And that's what we were doing at the beginning of this. And I love it. I'm doing a lot of exercising. You want to find out what's good for you and what's good for your family. Doing it together is fun. Maybe you take a walk with your children on the beach, or you take hiking on the beach with them. Do stuff with your family. Sleep is important for your immune system. And Fauci was talking about helping your immune system with sleep. And so stress reduction, of course, that's always important. That helps too, helping with that. So you want to control your diabetes, hypertension, and obesity, taking your medications that you need, taking care of that. And mental health, she already nailed it. Dr. Crusto talked about this. If you need help, seek help for depression, anxiety, loss, talk to family members. And I love this, outdoor activities, because nature can be nurturing and the green increases serotonin in your body. So the hiking, the cycling on the beach, going out in your neighborhood, picnicking, camping. My husband loves to golf. I do all of it. I play tennis. I like to do the picnicking, walking on the beach. I do cycling. I cycle in my home. If I cycle in my home, I make sure that I'm looking at another country. I don't want to say what maker of the cycle bike that is, but I also do outdoor cycling. This is all important. Please take care of yourself. And this is me and my husband this morning. As you can see, Saints fan from New Orleans. And we loved it. And so relaxing out there. So we wanted you to know that there are trusted Black scientists and physicians involved. This is different from before. Before, we didn't have all this involvement with the Tuskegee and the other situations that occurred. Now we have Dr. Corbett, and she was important in the mRNA vaccination with Moderna. Then we have Dr. Ogabugu, I can't say it. He was important with the Pfizer vaccine. And then we have Dr. Nunez Smith, and she's involved with the COVID equity task force. So we have many physicians involved. So they were at the table helping make decisions. They wanted to make sure it was safe for you. And Dr. Corbett, she has even said she made sure that you know, she pushed for them to have more representation of Black people on the trials so that we would know that it's safe. So it's awesome. You'll hear more about that on the talk with Dr. Bright.
Dr. Bright has some wonderful visuals that he is going to share when he talks about the vaccine on
Yeah. all this up on the CDC, but the neighbor thought that he had a sinus infection, and he thought that, oh, it's my usual sinus infection. So he didn't think it was a problem. But come to find out, the neighbor had been exposed to a coworker that had COVID. So he got exposed, and 5 days later, he finds out that he had COVID. So he had to call and let us know. My husband was asymptomatic up until to the 5th day. So day 4, my husband and myself, we had the inauguration occurred. So I was all excited. So we had a dinner. It was just my daughter and my sister, myself, and my friend. She was kind of distant from us. We all had masks on in my back of my house. So we didn't know that he had the COVID. So basically everybody got COVID. But the thing about it is my husband got the classic symptoms, and his symptoms were coughing, and, you know, he had a little bit of a fever. He had a lot of mucus, brown mucus. And again, 5 of his family members died. So I was really concerned. I didn't have any symptoms, but the RUAs, the emergency use, initially just said that 95% of people would be asymptomatic once they got the vaccine, but it didn't tell you whether those people would have disease or not. So that's what was important, was whether you're carrying disease or not. So I didn't have any symptoms. So they tested me day 1 and day 5 to make sure that I wasn't carrying disease asymptomatically. However, my sister, she got it too. And the symptoms that she got was just a sinus infection. Had she not known she was exposed, she would have thought, oh, it's just my normal sinus infection. I'm telling you the story, you know that it can present any way. So people may be passing it on and they don't even know they're passing it on. My daughter just got the symptoms of a cold, a runny nose, and she would have not known had she not known she got exposed. So that is going on too. People are exposing other people. They don't know, not on purpose, you know, so that is happening as well. And remember that N95 masks are 95% effective. So there is a 5% chance that you can potentially get infected even with that. So, and then we went over all the different precautions because I want to make sure that people realize that Black physicians are out there, and there's even a love letter, Black Coalition Against COVID.org, the love letter that is out there. So
it's really beautiful. We would definitely recommend that everyone look for it. And we will, Dr. Doucet, would you be able to put the link in the chat so people can watch the video?
Yes, I will. Yes, I will. Because, you know, it really is a love letter. It starts off with affirming that Black lives do matter. And as Black professionals, we have a higher calling to help with this racial justice and to fight for health equity. And that is important. So please visit that.
Yeah.
And then we are going to go on more information you can get from CDC about COVID itself, but we're going to have a vaccine talk from Dr. Bright. He's going to share a lot of great information. So we'll wait for questions after.
All right. Well, thank you. If you'll bring up my slide deck, that's great. I see our time right now, so I'm gonna have to move real quick. So move on to the next slide, please. So the main thing here, we know we talked about deaths, but what's more poignant to me is that as of January 2021, when we had only 300,000, remember I just said only 300,000, we're over 500,000 now, that one out of every 800 Black Americans has died from this disease. One out of every 750 Indigenous Americans has died from this disease. Next slide. You already know about Dr. Corbett, so we'll keep moving. So the things that you need to know about these vaccines: are they safe? Yes, they're safe. They've been rigorously tested. There were more than 70,000 people who volunteered for the Moderna and Pfizer trials. I think there were over 22,000 people who participated in the J&J trial. What we do know is that the vaccines are 95% effective in preventing COVID. After after 2 shots, you get 84% after the first shot of one of the 2 mRNA virus drugs, vaccines, excuse me. There really have been no seriously safety concerns. The thing that most people experience after is just mild sore arm, a headache, feeling tired. For myself, the first day I was tired a little bit on my first vaccine. On the second vaccine, it was worse. I was tired. I had a very sore arm. I took me some Aleve, and it helped to alleviate a lot of that issue. And so that's how you can mitigate those symptoms when you get your second vaccine. Tylenol is also what a lot of people use as well. Next slide, please. Here's the distribution, and this is important to know. You heard before that I advocated for increased diversity in clinical trials. Well, actually, here it is. And you look at it and you say, what doc are you talking about, man? It's like, 60s to almost 70%, predominantly white. But what I am talking about is for African Americans. Typically, we're less than 5% in any clinical trial. For us to have that double of that in number representation and to have 10% in both of these trials is pretty phenomenal. Next slide, please. So the more important thing here is that this slide is very fancy. It has a whole bunch of stuff on it, but the key is looking at the blue line and the red line. And the basic point is the blue line of people who received the placebo in the trial, and the red line of the people who received the Pfizer vaccine. And what you see is there's a distinct, what we call an inflection point at around day 12, where people who received the vaccine don't seem to start getting the virus a whole lot less than the people who received the placebo. That's how we know that the vaccine works. This is how the science is represented on a graph. Next slide, please. So the 2 shots are necessary. The Pfizer one is after 3 weeks. The Moderna one is after 4 weeks. Yes, I got that right. And it's important to get both doses of the same vaccine. Next.
Dr. Bright, there's a really great question that's related to what you just were talking about in the chat. Someone had asked, if you're able to get the first vaccine and you're told you're getting the Johnson & Johnson, will it pose a problem if you get the second dose of the same type? So is that question clear? Do you have any ideas or insights on that?
So meaning if you got the Pfizer vaccine and then the next available dose for you was a Johnson & Johnson, am I kind of getting that? Or
I
are you
believe
talking about?
so. That's what it seems from the question.
Well, it's preferable that you receive the same vaccine twice from the same maker even. Some have suggested that you could substitute a Moderna or a Pfizer interchangeably for the first and the second, but there's really no science behind that. We really want people to just do it as correctly, which is, well, if possible, the same 2 doses of the same mRNA vaccine or 1 dose of the Johnson & Johnson.
Wonderful. Thank you so much.
Yep. If you could click again on this slide. Okay, so this is important. So what I want to point out here is that when we look at the racial or ethnic groups here, when they got the vaccines in the study, you see that there are over 3,492 people, African American or Black participants in the study. Press that again. What's more important, though, is you look at the results. And of the 3,492 people who were in the study, there were 1,502 African Americans who received the vaccine. And of that 1,502, not a single one of them got COVID. 100% effective. 100%. To me, that was astronomical. I couldn't believe it. I've never seen data like that, that one group would be that well protected from the virus or from anything, any therapeutic measure with this type of a certainty. So now this is only among 1,502 people. This is not the whole world. So that doesn't mean that it's going to be 100% for everybody. But what it does say that you will have a very good chance of not getting anything from COVID with this vaccine. It's already taught by Dr. Doucet. Next slide, please. So I'm actually going to not get into all this information about what's next as far as the timeline for people who are at risk to get into their particular vaccinations. I think one of the major things we need to think about with vaccinations, number one, if you have two choices, one choice is to get the vaccine, the other is to get the disease. And what we know right now is better to get the vaccine than to get the disease. You know, the vaccine, it will give you, you know, a little bit of mild side effects. We know that the virus itself can cause you death. We also know that the vaccine can protect you from getting the virus. We know that getting the virus, we don't know how long it confers you immunity after you've had it. In fact, we are recommending that people that once they have had 90 days after they had become COVID positive, that they should receive the vaccine. So we want to vaccinate people who have already had the virus, okay? Because we think it confers more of an immunity to it. And then the other thing is, as you saw in Dr. Doucet's slides, there are a lot of things that happen long term with COVID that don't happen with a vaccine. So to me, the risk benefit ratio, it just looks more favorable for the vaccine than it does to get the disease. And so I'm not much of a gambling man. I don't like to put my risk of my life out there that I could just happen to be standing at a fence talking to my next door neighbor, and next thing you know, I got COVID. So I took my shot, and I hope that you'll consider taking your shot. Here's the bottom line. We want you to stay healthy longer rather than to get well soon. To me, that's the major point of all of this. This is about changing the paradigm of how we go about medicine. Oftentimes, we react into medicine. We have something that happens to us, it takes us away from our health, we go see a doctor, right? Where the paradigm of a lot of people that have wealth is that they have health that they want to keep. And so they go see the doctor preventively. This is our opportunity to jump from that reactive medicine to that preventive medicine and put ourselves in a position that we stay healthy longer rather than get well soon. And I'll stop there. Thank you.
Amazing. Thank you so much. So we have a couple of questions that have come up in the chat that we would love to address in the next couple of minutes. So someone asked, if a person has numerous health issues and has been okay thus far, but a physician still doesn't want them to get the vaccination, do you have any suggestions?
Why would a physician not want them to get the vaccine? That's problematic for me. I mean, that physician hopefully has seen these 500,000 people that have passed out here. 1 in every 800 Blacks in America. 1 in every 750 indigenous people in America. How are you going to tell somebody they shouldn't get? I'm sorry. I'm getting on my soapbox.
No, that's completely all right.
What's up with that?
I want to echo that. You know, I'm shocked that they told them that, but the only reasons not to get, if you have, of course, anaphylaxis to vaccine,
Right.
or anything in it, like the PEG or the polysorbate, or they want you to wait if you've had the convalescent antibodies for 90 days. Those are the reasons not to. And I got my first vaccine. I did get some of a reaction to it. I got some redness, a little itching just in my legs. So I went to allergists afterwards to get the second vaccine and to do it properly, you know. So it was great. I'm telling, it was worth it because it saved me from getting COVID, and I was so happy. So, anyways.
So on in a similar vein, someone asked, should they get tested after they get their vaccinations? I know that we've discussed that there can be some symptoms. You know, if someone happens to get tested or does get tested after they get the vaccine, what would that look like? And should they do it?
Well, I'll go first at that. What I would say is they should get tested if they have been exposed.
Right. Yes. They should get exposed. That is the answer for sure. Because again, it's 95% effective. You can get it 5% of the time. So if you've been exposed, then you definitely need to, which is what happened to me. I actually got a large exposure because my husband was coughing all night, and COVID, as you know, got aerosolized throughout my bedroom everywhere. So I was doused in COVID. Okay. So
Yes, you were.
yeah, I was. And I said, well, now I can see if the vaccine works. You know,
Exactly.
so I did, and it did work. So they tested me multiple times. So
So the last question that we will have for the evening before we wrap up, and thank you for everyone for hanging around, sticking around, and thank you so much to our doctors. It has been an extremely informative evening. So the last question we have is, how can we keep people engaged until they're eligible to get the vaccine? Especially considering vaccine hesitancy, because someone who's, say, 30 years old, who might not be able to get the vaccine for another couple of months, you know, with all the misinformation going around, they might then become more hesitant. So how do we keep our family members, community members engaged?
yes, so I would say like this, you know, telling your family members about, telling your story, because you know I've told multiple people about my story, even nurses that I have worked with that did not get the vaccine. They heard about how effective it was and how it stopped me from getting COVID, and you know I didn't have to suffer the consequences. And somebody asked about symptoms after the vaccine. They show up the same day. They're mild symptoms, but it just says that your body is actually working and building the immunity. When you get those symptoms, oh, your body's working. We get a headache, mild symptoms, fatigue, or whatever. You may take a Tylenol, but your body's doing its job. It's building antibodies, and that's what you want. So you don't worry about these symptoms. They're short-lived, and that's a good sign.
So I totally agree with that. And I see our 4-year-old showed up. That's awesome. I was hoping she would make an appearance. There's a person who asked about vaccines in Philadelphia. And what I will tell you is that there is a consortium of Black physicians and healthcare workers in the Philadelphia area who are actually doing vaccinations in their community. Look out for that. I heard that they were actually able to vaccinate people who were within walking distance of their place where they set up. So I think that's very important to look out for. There's another question about how long before symptoms show up after the vaccine. Within about 8 hours, 6 to 8 hours, you start feeling the soreness in your arm. But you know, as stated, they go away over the next day or two.
Wonderful. Thank you so much to all of our guests. Thank you, Dr.
I'm
Doucet.
sorry.
Thank you.
Can I get one more point in?
Oh, of course, of course.
Because you asked about the 30-year-old, right?
Sure. Mm-hmm.
And so about the 30-year-old. So yeah, you're going to be way down the line, but here's the deal. I really think that the Johnson & Johnson vaccine is going to be the one that's going to be utilized more in our younger people. Number one, they don't want to get 2 vaccines. I didn't want to get 2 vaccines. In fact, I became a doctor because I hate getting shots. I always thought it's better to give than receive, right? And so I think that our younger people will be that target between 18 up until the 30s will be the ones that we will really target with that 1-shot vaccine. And let's really get the 2-shot vaccine to our people who are more seasoned, like myself.
And Carmen, one last point. I think, you know, you don't want to be that story where you were living your best life and you passed it on to your grandparent or somebody else that hadn't had the vaccine. I've heard that story multiple times.
Yeah.
Even
Also,
within our own family. You know, an 18-year-old was with our cousin who was their grandmother, and she got the virus and died. Another one of our friends, her cousin had living her best life, gave the virus to one of the parents, and they died. You know, you don't want to be that person. You don't want to have that on your plate, even if you particularly think you're not going to get the virus. So
most definitely. Well, thank you so much to everyone who has come this evening. We have a final poll, again, just to help us to collect information. If you could fill that out before we close. We would like to thank you, the entire UR would like to thank you. And on behalf of Crystal Emery, we hope that we were helpful. Thank you to our doctors who have joined us this evening. And we hope that you'll join us again on March 9th in Spanish or on March 15th in English. As always, the links, the phone numbers, the passwords to get into the town halls will remain the same. And please spread the word, invite your family and friends to these events. They will be made available within the coming weeks. We've been recording them, so this information will be available on our website. I believe Ruth put it in the chat, so then people can find it there if you're interested in sharing. Again, we are humbled to be a servant to our community. Namaskar. Thank you so much, everyone. We appreciate all of you for coming tonight.
Carmen, there was a question about recording. They wanted to know about the recording. Can they access it?
Mm-hmm. The recordings will be available within the coming weeks on our website. Thank you all so much.
Thank you for having us.
The rest of your evening. Thank you.
It was a pleasure. Have a good night, everyone.
Indeed. Stay safe. Remember your 3 W's. Wash, wear, wait.
Yes. Thank you so much.